This time a year ago, we were all digesting the news that COVID had in fact arrived in South Africa. But of course, it had not yet taken hold in the country. Has it played out as you thought it would?
I think, unfortunately, it's played out in my worst nightmares. I think for most of us, we didn't anticipate we'd be sitting a year later in a completely transformed society. So, yes, I was hoping for a much better outcome. We were speculating at the time that somehow Africa would be spared, that somehow our young population, issues around genetics or other circulating coronaviruses would protect us. But unfortunately, it hit us, and it's hit us terribly.
And of course, your work up until this point has very much been around HIV/AIDS, and there was huge concern that if people with HIV/AIDS became infected with COVID-19, they would get terribly sick and we could have a massive catastrophe, even worse than we've seen on our hands. But it didn't work out that way, or did it?
No, it didn't, and thank goodness for that. We've got 7-8 million people with HIV in the country. To have even more vulnerable populations than we have would have been an absolute disaster. There does seem to be a small increase in risks of hospitalization and death in people with HIV, but it was nowhere near what we feared. In fact, it's the same sort of risk as being male versus female. Men have slightly worse outcomes as well than women. I think what we have been a bit shocked at is how many diabetics have been affected. It's another epidemic in South Africa. Is diabetes, and it's a major risk factor for hospitalization and death. And there we've certainly seen that community has been decimated.
Why is diabetes such a risk factor? Do we actually know?
It's speculative at this stage, but what I'm sure everybody on this call now is an expert on T-cell immunity or has heard of it. Or it's a bit of an arcane area. Nobody was found it interesting beyond immunologists before this. But one of the speculations is that both aging, we know that age is a risk factor for severe COVID, as well as having diabetes does affect your T-cell responses as you go along. And we speculate that some of that gives you this disrupted immune reaction that seems to put you in hospital and kill you in a significant minority of people.
Let's talk about the vaccines, because we've had a bit of a bumpy start. As we were about to roll out AstraZeneca, we saw that it wasn't as efficacious as we had hoped against the dominant variant here in South Africa. We have now had 90,000 people vaccinated, healthcare workers. People are worried it's too slow, but we know that the big phase, the big challenge, I think, is going to come in April when we start with phase 2, which is going to be the elderly, those with comorbidities, and those who are essential workers. Do you think we're up to the challenge?
It's going to require the whole society to get behind this. Simply leaving it up to the health department or your medical aides isn't going to do the trick. At the moment, we're vaccinating around 5,000 people a day. Some of the estimates are around we're going to need to be up to 200,000, 300,000 a day. And in fact, if anything, observations of the third waves in other countries and preliminary evidence that we might even be in the start of one now suggests we should be getting every elderly person, every diabetic, every person with a serious comorbidity vaccinated as quickly as humanly possible. Now, 90,000, it's wonderful, and I thank goodness. I don't know, in my wildest dreams, I didn't think we would be there. But we have to go much, much, much faster. That's going to require the whole society to get behind it. Just your question on the AstraZeneca vaccine, I really do think it was a mistake to send that away. Those million doses, we could have started already. There was no evidence that it didn't work. It didn't seem to be as effective in the variant in terms of protection from infection. But everything we know about all 5 of the vaccines is they are phenomenally safe and phenomenally effective from serious illness. So I think we need to be telling the public that whatever vaccine is offered to you first is the best vaccine for you. They're all very, very good.
Didn't you receive AstraZeneca as part of the clinical trial at Wits?
Yes, that's right. I was part in June. A whole lot of us decided to go and show our support for the vaccine people. South Africa's got amazing vaccine researchers, so we kind of rolled up our arms and went out. Again, it was a bit of a PR exercise at the time. I didn't expect that I'd be so protected at the end of the study. So, lucky me. But the beauty of this is that the country now can benefit from that data, and we can get back to our lives back to normal.
And you haven't succumbed to COVID since being jabbed? Not at all?
No, I've been skulking behind closed doors, though, so I'm not exactly the high-risk group.
As we move into year 2, is it just going to be more of the same, or are there big lessons we need to embrace now? You were mentioning the third wave might come quicker, sooner than we expected. What do we need to have on our radar as we move into year 2?
So I think that we need to anticipate that there will be further waves, whether they're bigger than the last one, which seems a bit implausible considering how bad our second one was. We just need to have the society a little bit more adept at handling. One thing I think the health system has done incredibly well. The second wave was far worse than the first wave, but the health sector and the health workers seem to have learned from the first one, are much more adept at dealing with that. So that is good news. We just need to be very, very flexible, anticipating the various forms of restrictions and things which might need to be applied, might need to be done very, very quickly. In Portugal, for instance, their third wave happened almost 2 weeks after the second wave. So if we, which might be the case here at the moment, is that a month after the second wave was kind of dissipating, we might be in the midst of another one. Or it might be, as we initially projected, that it comes along in June. So just be prepared, get the vaccine.